Hi, my name is Anna, and I just wanted to share what my shoulder surgery experience was because when I was getting ready for surgery, I wanted to hear what other people's stories were, what it felt like, or what they went through, what was helpful, those type of things. So I thought that I would share so that it could benefit somebody else that might be a visual or tactile learner and help them to prepare for their own surgery. So I hope that this is helpful for you. Um, so I was originally going in for a slap tear repairment, and then, which is basically a slap tear is a type of tear in the labrum of the shoulder. The labrum is kind of what helps to hold or to keep the shoulder in place. And I was having problems with my shoulder was going in and out of the socket at different times. It would feel like it was stuck. I had impingement, which is where the ligaments or different things would get stuck and it would be super painful. And I pretty much couldn't do much over my head with my left arm. And so it took about, I started doing therapy in April, I believe. And I just had my surgery October 15th. So it was a long process of trying physical therapy to see if that would help. And then I did one cortisone shot, and that, I think, took away the pain from the back of my shoulder. They did the cortisone in the back, but I still was having a lot of pain in the front, I guess where the bicep tendon is at. So my surgery was yesterday, so this is post-op day 1. And so I'll just tell you first a little bit about what it was like getting ready for surgery, going in, coming out of it, and then I'll share kind of how I'm feeling now. So I got to the surgery center at about 10:15. They said my surgery would be at 11, but depending on where you go, there might be a surgery ahead of time, so it kind of just depends on how long that one lasts and to set your own surgery time. So the one before me ended up going longer, and so I didn't actually go back for surgery until about 12:30. When I got there, they checked my vitals. They did, they set an IV and got some fluids going in me. And then my doctor came in and talked to me, did another exam of my shoulder to see if it was still consistent. They actually wrote on my arm to make sure that I was doing the correct arm, which is my left shoulder. And then the anesthesiologist talked about how I was doing a nerve block, which essentially numbs so that you don't feel your whole left arm. And then talked about general anesthesia, what that was going to look like. And then they took me back. My husband had told me to try and remember how high that I counted before I went to sleep. And I remember them asking me what I do for a living. And I'm a stay-at-home mom. I have 2 kids, ages 5 and 3. And so, they talked about that must keep me on my toes. And then I talked about being on a jump rope team, and that was the last thing I remember. I don't even remember counting. So they did put some oxygen. I breathed a little bit of oxygen that may have had some sleepy medicine in it. It sounded like that they were going to give me some sleepy medicine through my IV, and then they would do the general anesthesia after that. So it didn't seem like it had been much time at all, and then I woke up. And for me, I don't know, the experience with anesthesia is different with everybody, so this may not be what happens for you, but I woke up and everything was in fast motion. So it was like somebody hit the fast forward button on my brain, and people were just moving really fast. I remember seeing a lot of people around me, and I'm pretty sure that I woke up in the recovery room because I remember them saying that the doctor had checked my hand and my fingers, making sure that I had sensation and feeling in them before they did the nerve block, and I don't remember the doctor doing that. So I think I must have woke up in my recovery room. When I woke up, as I was coming to, my pain level was probably at a 10. And the reason I wanted to share that with you is because all of the stories that I had seen of other people that had had the similar surgery, a lot of people said that they didn't really feel much when they came out of it. Come to find out, once they got in there, my shoulder was completely different than what they were expecting. They thought it was mostly a torn labrum with some issues with the bicep tendon. Turned out that I got to be one of the lucky 5% of people that have shoulder surgery that have really, their bicep tendon is really messed up. They said there was a lot of scar tissue, and they went down to do something lower on the bicep, came back up, and the tendon was still stuck. And so there sounded like that the surgeon had to get creative, because it was an arthroscopic surgery and not an open surgery. It was harder to see some of the different things, but I'm very thankful that my surgeon was able to do it without having to do a large incision. That will help my recovery and probably pain as well. So I'm very grateful for that. So it took a lot longer. The normal time for the surgery is an hour or less. My surgery was over 2 hours. So I had general anesthesia in me for 3 hours because they do it for a certain amount of time before the surgery, I guess. And then you're still in, it's still in your system afterwards. So, but like I said, everybody's surgery is going to be different. How you react to anesthesia is different. What is actually wrong inside your shoulder is different. So there are lots of variables of what could happen, and how you will feel. I know both my dad and grandma and different family members have a hard time with anesthesia. And I think I was just hoping and expecting that I wouldn't have a hard time with it. Come to find out, I did a little bit. They sat me up, and I remember thinking, I don't know if I'm quite ready to sit up yet, but I was still groggy and wasn't really very, very assertive, I guess. And so they sat me up, and I was sitting there for a little while, and I thought, I think I should probably lay down. So I asked to lay down, and the nurse probably could tell on my face. She was like, "Are you going to throw up?" And I said, "Yes." Sometimes you don't have enough time to get the yes out, but I was thankful I did. So she handed me one of those the kidney bean shaped containers that you associate with the hospital. And I was very lucky that all of it, I did throw up, and all of it fit in that little container. So I hadn't really had any food before, because you're not supposed to eat or drink anything after midnight the night before your surgery. So I was very thankful that it was mostly just water, and it wasn't too bad. I've had worse before. But so I did that, and then basically it probably would be different if you're at the hospital or if you are at a surgery center. But since I was at a surgery center, they try to, I think, get you home as soon as possible after your surgery. So after that, they let me lay down. They got some anti-nausea medicine in me through the IV. And then after about, 15, 20 minutes, then we tried again, and I was able to stand up, and the nurses took me so that I could go to the bathroom, and definitely was a challenge trying to go to the bathroom, and but once I did that, then I went back to my recovery room, and I got dressed, and I was able to go home. They wheeled me out in a wheelchair to my car. My husband drove up to the entrance and then took me home. So I got home, got settled in. This is kind of my post for now. I'm in a recliner, which is very helpful. I have 5 pillows. So pillows are going to be very helpful. I have one under my leg. I have one under my shoulder back behind my shoulder because the doctor said they don't want your shoulder to be leaning back, so you want to have some support behind it. I have one underneath my forearm as well to kind of prop up my sling. And then I have one behind my head, which is helpful for sleeping. I know that there are round pillows that specifically will fit to the back of your head on Amazon. I just didn't get one of those because I figured I would use what I have for now. So I do have a sling, and right now something else that I have is I think it's called a polar ice machine, but it's this pad that you put on your shoulder, and then it hooks up to a cooler and you fill it with ice, and that helps to circulate the cold water all around your shoulder, which has been very helpful. Yesterday, as soon as I got home, we got it hooked up and going, and I had seen that somebody else had put water bottles in the cooler instead of ice because it was much easier and faster when you had to refill it. So, and then my husband had the idea of putting the water bottles in there but leaving the cap on so that you're still keeping it cold. But once that melts, then you're taking them out and you're not having to dump and refill and all of that. So that was helpful to make it not as messy. I mean, I'm not the one that's filling it right now. He is anyways, but that was helpful for me. And then I also have, because I was nauseous, I found I was able to eat some Ritz crackers first and just water, but to do it slowly. So even if you think you might not be terribly nauseous, I would encourage you to get back into food and liquids slowly, because it's not fun throwing up when your shoulder, when you can't move your shoulder and all of that. But so I had that, and then I found that the Ritz crackers were just super, super dry in my mouth, because when you have the anti-nausea medicine, that can kind of take out all the saliva. That's what the nurses said. And so then we had some graham crackers here, and so I tried some of that, and I think the sweetness helped, because I had one time where I threw up about a half an hour after I had taken all my medicine, so then I had the medicine taste in my mouth, and the sweetness from the graham cracker, I think it was honey graham crackers, just happened to help take that bitter taste out of my mouth from the medicine. So far, I've been able to keep everything down. I had another thing that I've had is bread with butter on it. That's been helpful too. And water. And then I would also encourage you to take however the pain medicine that they direct you. It's not good to have to play catch up, because it takes a lot longer to manage your pain if you wait and say, I think I can get by with this. It's better to be on top of it and to keep it at bay. So my nerve block is starting, it's pretty much worn off now. That was very helpful for being able to rest last night. But I probably only rested for 3 to 4 hours total. I mean, I dozed in and out here and there, but, and then today I've rested throughout the day. Once a nerve block runs off, then you definitely want to be taking the pain medicine. And I also had anti-nausea medicine. Everybody's doctor will probably prescribe something different, but I also suggest doing a stool softener, because it's not fun to get constipated, and that can happen when you take pain medicine. But yeah, I would say right now my pain is pretty controlled. Because it was a 10 right when I came out of surgery, it hasn't been that bad since then. It's probably at the most been maybe a 6 or 7. But the ice machine definitely helps. I have had that on probably all day yesterday, all through the night. And then I've taken some breaks today, had it off for a little bit. Another thing that they encourage you to do is get up and move every couple hours, basically just moving all the time to help prevent blood clots. I would suggest the first few times that you get up to do it baby steps, not to walk like all the way around your house, just to take a few steps, maybe go in a circle or move around and then go back and sit down and gradually work your way up to walking more, just so that in my case I ended up throwing up because I think I did too much too soon. Yeah, I have a little bucket that has TV remotes. I have my medicine. It has some crackers in it. And then I've actually used just a cup like this with a straw because it's much easier to use than a water bottle or something. I guess if you have a water bottle that has an easy lid, but something that you can just do with one hand. Yeah, and also I would say, it's going to probably be about a week until you can take a shower, depending on when your follow-up appointment is and what your doctor says. But so I would suggest having some dry shampoo, some spray deodorant, and a washcloth that you can use just to kind of bathe. But I would say, at least, I know this is the first day post-op, but I have not wanted to even think about taking a shower. Today is much better than yesterday. Yesterday was probably the worst. Some of that is just trying to get comfortable, and you're used to sleeping in a bed. It's hard to sleep in a recliner. It's much better than sitting in a chair, like a rocking chair or something like that. A recliner is nice, and you want to make sure that you get a recliner that has the arm handle on the opposite hand so that you can get it up and down on your own. That's very helpful too. So I hope that this can encourage you and that it helps to prepare you for your surgery. Again, I'm not a doctor or anybody that is giving medical advice. I'm just sharing my story of what my shoulder surgery is like, and I will continue to update you as my recovery continues and progresses. And I know it's going to be a long road, but I'm just going to try and take it one day at a time. I know that God is going to be with me every step of the way, and I'm very grateful and thankful for that. I hope that you have a good day, and that if you're having surgery, that yours goes well also without complications. Thank you, and I will see you guys a little bit later. Bye.